hop in and say welcome. And welcome to the Patrick Henry building. And I was really happy that we were able to all have lunch. And I just mentioned to Senator Locke and Senator Lucas, we should do this more often. And so thank you for coming over here. Just three quick comments, and then I'm going to let you all continue the incredibly important work that you're doing. One's just personal. So my mother was a nurse, and she, in fact, became an OBGYN nurse practitioner. And she spent a vast majority of her career working on maternal health disparities. And so this is something that I talked about at our dinner table growing up as a child. And I'm just so happy that the work continues. It's real. Our maternal health task force met yesterday and has incredible data on what's going on across the Commonwealth and the country. And the fact is that we know that there are disparities in maternal health outcomes. Full stop, that's it, we know it. And then the question is, how do we make sure we get at the causes and address them? And we hear from, of course, the communities most impacted by this, the Black community, the Hispanic community, the Indigenous community, rural communities. And so I just thank you for the work that you're doing. The second key point I wanted to make is I just wanted to thank the legislative members who are not just here, but also are participating in the task force. And so, Senator, thank you so much for your participation. And I think Delegate Tata is here, have been participating in this as well. And I also believe, let's see, where is, oh, yes. Perfect. The leader of course, our leader of our majority house is here. So thank you so much. And I think Senator Jordan is also involved with our maternal health task force as well. And so thank you all for the tremendous work that you put in. For those of you who are not from Virginia, I finally want to welcome you. I want to welcome you to Richmond, Virginia. I want to welcome you to the Commonwealth. And I also want to acknowledge something that I am always reminded of, that while we in Virginia have what's often affectionately called a citizen legislature, our legislators work full-time. And I know you do as well. And the fact that you all have traveled to Virginia to participate in an incredibly important conference, I just want to thank you all for doing exactly that. And so thank you for being here, addressing an incredibly important topic. And most importantly, let's get to work. And so thank you all. God bless you. Thank you.
Thank you so much, Governor. We're going to take about 10 more minutes, and then we're going to get started with our program. So please enjoy your lunch. Is everybody enjoying themselves, enjoying their lunch? It's been such a wonderful day of very great discussions about this very important issue. We're going to go ahead and get started with the program. I'd like to bring up one of my Senate aunties, the President Pro Tem. Yes. Not my house aunties, no offense. I see you over there, Sheila. President Pro Tem Senator Lucas, let's please give her a hand.
That is so funny. On social media, I got so many nephews and nieces. This is phenomenal. Well, I just want to reiterate what I said last night and again today. I'm just so excited about what we're about to embark upon. This is one of the most critical issues of our lifetime. And I think Congressman Scott told me that he had remembered just a little bit of my story when I restated it again today, because a lot of people didn't know. Most people look at us like, you all legislators, you all are the stars and all that, but they don't know that we all got stories. Because for me, for those who did not know it, I was a 14-year-old high school dropout. 8 months after I was 14 years old, I had my first child, who was not a Natalie Stanhope. This is my granddaughter, Natalie, was her father. So you're talking about a long journey from there to here, but as all of us have stories that we like to forget, how does a 14-year-old know how to give birth to a child? You don't. And I can remember being in labor for 2 days in the hospital, and this snotty-ass nurse comes in the room. I tell her, I don't know how to do this, and she said, you know how you got it? And I said, I don't know that either. But truth be told, we all have some stories, which makes this one of the most critical issues of our lifetime. I mean, this is life-saving what we're about to do. And as I said last night, each of us have been doing our own piecemeal kind of a work across our states, but working together, we're going to make this happen. And I'm glad that my granddaughter is here, because when I say this is important to me, I have now daughters, granddaughters, and great-granddaughters. And my granddaughter, Natalie, right here, has her own personal story with 2 miscarriages and all kinds of complications with pregnancy. As a mother, a grandmother, and a great-grandmother, this is critically important to me. And I will not stop as long as I have life and breath in my body until we do something to make sure that we have adequate health care for women of color, and I'm speaking specifically about Black maternal health care right now. I will not stop until we solve this problem. So what did I say last night? Together, we will solve this problem. I got to go install the judge, so you all have a good afternoon.
Thank you, Senator. And thank you everybody else throughout the day for sharing your stories. It really makes things really tangible in the stories. And as we worked throughout and finding solutions today, and as we continue to with the legislation we're looking to present over next year. But we're going to move the program along. And before the panel, we're going to have a speaker. We're going to have Dr. Melissa Clark, who is the Chief Health Equity Officer at Elevance Health. So please, let's welcome Dr. Clark.
Good afternoon, greetings, everyone. I am truly honored to be here to speak to you today about, as Senator Lucas said, a critical issue for all of us. And I want to thank the Black Maternal Health Legislative Summit. I want to thank Delegate Askew, Speaker Scott, and of course, Senator Lucas for convening this extremely important legislative gathering today. So I want to really talk about how we at Anthem are committed to being part of the solution when it comes to maternal health equity. We're really proud of Anthem's long history in Virginia, and I too have a tie to Virginia. I just discovered before I got up here to speak that I grew up on the same street in Virginia Beach that Delegate Askew did. So I have deep Tidewater roots. And so I'm really, again, another reason why I'm extremely pleased to be here today. I spent many an afternoon on the campus of Norfolk State University where my mother taught. Shout out to NSU in the house. So if we could have the next slide. At Anthem, we really believe that focusing on whole health, that means physical health, behavioral health, and social health, is really key to driving healthcare value and equitable outcomes. Our whole health approach is really anchored in advancing health equity. So we have a health equity by design mantra, which simply means that we proactively design and embed advancing health equity into our operations for the best possible health outcomes. This health equity by design strategy is an intentional approach to ensure that everybody, regardless of race, ethnicity, sexual orientation, gender identity, disability, geographic or financial access, can receive the individualized care that they need to maximize their health. We also have our Whole Health Index, and that's really designed to drive improvements for the consumers that we serve. It's a first of a kind evaluation that consists of 93 measures of health, physical health, behavioral health, geographic and social factors that together produce a single score, 1 to 100, that quantifies each consumer's whole health. And using this score, we're able to tailor interventions to increase access to care and improve access. For example, increasing flu vaccinations among those who are greatest at risk. Next slide. And then, of course, while we're here, maternal health. We know that it is a serious concern in the United States, with hundreds of pregnant people dying each year needlessly. 84% of deaths are preventable, according to CDC data. And these challenges, we know, are particular for women of color, especially Black women. 2 times the number of maternal deaths occur in the United States compared to other industrialized nations. We know 3.5 times is the likelihood for Black women dying in childbirth compared to white women. And if you're giving birth later in life, there's a 66% higher chance of a serious complication if you're a Black woman compared to a white woman. So next slide. So with this in mind, at Anthem and our affiliated plans, we actually provide insurance for 1 in 8 of the nation's births. So we're in a very unique position, and we're committed, while we're in that position, to improve maternal health outcomes and reduce health inequities. This can be done in part with all the holistic programs that we use that are data-driven, involve clinical support, and recognize and meet the social and behavioral health care needs of expecting parents before, during, and after birth. So there are several listed up here, and I know I don't have a lot of time, but I want to touch on a few. The first is we deploy custom healthcare supports for our pregnant members across the country, including here in Virginia. We have a 10-pronged approach, as you see on the slide, which represents our commitment to maternal health equity by expanding access to care, increasing access to a broad net of providers, diversifying the healthcare workforce, and enhancing data collection and reporting. In our whole health solutions, we pair digitally enabled member-facing education tools with nurse care managers, so the best of technology, but with a personal support. And that's done week over week in a person's pregnancy journey. So by providing members of these needed community supports, trauma-informed care resources, and educational information via a private digital app, members can really access the resources that they need securely and privately, even perhaps in situations where they might not feel comfortable doing it otherwise. When it comes to doula care, I know there's a whole panel on doula care. We've also invested in doula care because we recognize that through multiple research studies, Women who use doulas have fewer inpatient admissions during pregnancy. They have decreased preterm birth rates and lower prevalence of delivery by cesarean section. So we've invested in the capacity building of community-based organizations to really enhance doula care through training and education across the country. And we're expanding a doula network to fully utilize Medicaid benefits while deepening our strategic approach to commercial members in the absence of that benefit. I also want to touch on food as medicine, because nutrition is a critical component of a healthy pregnancy. Studies show that proper nutrition decreases the rate of low birth weight by 14% and preterm birth by over 20%. So we deploy a food as medicine program for our pregnant mothers in Virginia who are at high risk for poor birth outcomes. It centers on nutritious food, personalized nutrition education, and all designed to decrease nutrition insecurity and improve birth outcomes. And two more pieces to touch on. Peer recovery, really helping reduce the incidence of neonatal abstinence syndrome by matching women in recovery with who are recovering from substance use disorder with support from a specialist. And then finally, our provider enablement. We have a variety of programs that involve providers and foster quality improvement, like our implicit bias training, our obstetrics practice consultant program, and our obstetric quality incentive program that aim to improve maternal and infant health outcomes. The OB practice consultants are clinicians who collaborate in person and virtually with over 3,700 providers around the country in 24 different Medicaid markets to link care between the provider, the patient, and the payer, and support better health outcomes and provide timely and relevant data about how we are doing in improving maternal health outcomes. We've seen incredible, powerful improvements. 12% reduction in preterm births, 20% reduction in low birth weight deliveries, and a 67% increase in post-delivery visits by pregnant mothers after they deliver. And the last slide. So last but not least, I want to touch on our philanthropy, because that's an incredibly important piece of all of this. So through our foundation commitments, we strive to improve the health of humanity. That is our mission, by addressing health disparities across communities. So in 2024, we've awarded over $97 million across our 4 focus areas: reducing substance use disorder, improving maternal health, encouraging food as medicine, and supporting community disaster relief. And you see the figures up there, so I'll just focus mainly on maternal health. We've awarded $30 million to address maternal health across the country. And here in Virginia, specifically in maternal health, we've awarded $2.3 million across the state to train doulas, to enhance telehealth services, expand peer supports, and provide implicit bias training. And we've seen excellent progress in the goals to improve maternal health equity, specifically reducing the disparity in preterm births between Black and non-Black communities by over 5% relative to the organizational baseline in 2022. So we know that there's a lot more to do, an incredible amount of work to do. But we're proud to be here today and stand with you and partner in these crucial efforts. Thank you very much.
Thank you so much, Dr. Block, for your remarks and your presentation. Next up, I'd like to call up now Senator Aird, my former colleague in the House, Senator Aird, and introduce your panel. And Candy reminded me that I did not introduce myself. I'm Delegate Alex Askew, representing the 95th District in Virginia Beach with a little bit of Norfolk in my second term. And it's a pleasure to be here before you all today.
Hi, good afternoon, everyone. If I could have my panelists please assemble here at the front so that we can get into our lunch panel discussion. Thank you so much. Again, good afternoon. I am Senator LaSharice Aird, and I have the great honor and pleasure of serving as Senator of District 13. And I also want to echo the sentiments that have already been shared in thanking both Senator Louise Lucas, Speaker Scott, as well as the amazing women that make up the Maternal Health Caucus in the House and the Senate, which is a bipartisan group. And thank in advance each and every member of the panel here today. Our panel is titled Living My Best Life, Policies to Advance the Health and Wellness of Black Women. I think that it is very clear that we are all here because we care deeply about this issue, but ultimately I hope that by the end of today's discussion, not only will we hear from the lived experience of these experts, but walk away with several recommendations on what next steps look like. Because what you've heard throughout today and what you've heard from our immediate past speaker, Dr. Clark, one death is a death too many as it pertains to Black maternal health. So please join me in welcoming our panel, a very distinguished group. I'm pleased to have Dr. Melinda Scott, who is a dedicated dental surgeon. We have Ms. Kay Matthews, who is the founder of Shades of Blue. We have Dr. Faith Metlock, founder of Black Health Explained. And we also have Dr. Hillary Wander Jenis, the Planned Performance Medical Director of Anthem Health Keepers Plus. And last but not least, Representative Diamond Staten Williams of the North Carolina House. And so we're going to jump right in for the sake of time. And so if there is anything you'd like to share to give us sort of a lens into the perspective in which you're offering your responses from your background and the titles that you hold, please feel free to do so in your opening answer. But the first question that I like to ask is, you know, each of you have focused your work on underserved communities and increasing their access to care. And so I would like for us to get an idea of what has kept you doing this work. I think it's easy oftentimes to say, well, I care about my community, I care about increasing access, but you could have gotten into this work and said, you know what, it's not for me. But what has kept you in this work? And also describe the spectrum of challenges and barriers that you have seen while doing this work. And we'll start right here with you.
So, Kay Matthews, by title, I am the executive director and the founder of the Shades of Blue Project. Every day I remind myself as to why I do this work. One, the work chose me, I did not choose it. Almost 12 years ago, my birthing experience had an adverse outcome. My daughter was born still, and it was the first time that I realized that the care that Black women in America receive is subpar. Everything was really, I felt like, based on the color of my skin, something as simple as asking me, did I have spousal support? And my husband was sitting right there next to me in a chair. And so I struggled more so on the mental part, because when you lose a child, it is always the grief that they put you in a box. And I was just like, no, my baby's not here, but I'm still here. So who's going to save me? And so our focus being simply around Black maternal mental health for almost 2 years. It's just that because the postpartum period is, the birth almost killed me, and then the postpartum period tried to finish it. And I don't feel like in any capacity should any woman feel like that, but especially not ones who look like me. And so that is why I do this work. It would certainly be different if it was my job. I'd have quit a long time ago. But because it chose me, I show up authentically myself because even on my healing journey, I made a silent promise to myself. If I got better, then I was going to scream from the mountaintop how I did so. And so that is why doing, doing this work and really understanding that what is happening in maternal health, um, what continues to be an and or part of the conversation is the mental health. Imagine all the things that we are fighting for to get better in maternal health, but how people actually feel about what they are having to do or what their adverse outcomes are. But yeah, that's what keeps me doing this work.
Thank you. My parents are both healthcare professionals, and I was privileged growing up to see. Thank you. To see and experience, witness their fruits of labor as they gave back to their community. They both started with nothing. My mom was a sharecropper, and I remember going to both of their houses. You could see through the wall, so they started with nothing, and they both became fabulous healthcare professionals. So I've seen what they were able to do, give back to the community, and that inspired me to continue in their footsteps in both professional and with giving back to the community.
Good afternoon. Good afternoon. My name is Hilary Wonder Genus, and I sit here as the Chief Medical Officer for Anthem Health Keepers Plus, the Medicaid line of business. And as I think about the work that I do every day, I think about the people that I'm serving. And the work that I do is not to make myself look good, but to empower little girls who look like me to be what they can and want to be. And that brings me back to my experience as a medical student. I went to a medical school in upstate New York, and out of 200 plus students, there were 8 of us who were of color. Unfortunately, only 2 of us graduated. And in that process of going through medical school, I was told many times that I should not bother because you'll never become a doctor. And so I went home, tried, my daddy said, absolutely not. Over my dead body, you're gonna quit. And so I'm glad that I didn't. And though the journey has been challenging, certainly I go to work thinking about what other little girl needs to have this opportunity that I had to show that I didn't quit, she doesn't have to quit. And so also being able to provide a safe place for her to grow up, a safe place for her to experience life, a safe place for her to deliver the next generation of leaders. I'm hoping that my role at Anthem is to encourage, empower, and to continue the work that has begun.
Faith Elise Matlock. I stand here holding 2 positions or 2 hats. I am a PhD candidate at Johns Hopkins School of Nursing and president. I am also president and founder of Black Health Explained Foundation. And so a little bit about my story. I'm originally from Cleveland, Ohio, a city like many others that faces significant health disparities. And so early in life, I was always inspired to go into healthcare because many of my family members struggled with chronic conditions. Whatever chronic condition there is, you name it, someone in my family has it. And so I wanted to go into healthcare to make a difference and support communities like my own in mitigating some of these risks we face, because I knew early on as it related to my family, that our neighborhood was impacting our health. My mother was having doctors tell her to work, exercise and get more physical activity, but they never asked if the neighborhood we lived in was safe enough for us to do that. And so early on, I knew that there was something we were missing in healthcare, some questions we just were not asking, and really getting to the root causes of some of these disparities. And so that inspired me to pursue a career in nursing at The Ohio State University, where I graduated. And so during my clinical time at Ohio State, I noticed that once we were seeing patients in the hospital, it was too late. there was only so much that we could do to intervene on their health. And so this inspired me to take my clinical expertise out into the community and to meet people before the chronic conditions or any health problems happened. And so that's where I began to provide blood pressure, blood sugar, cholesterol, and weight screenings to people in the Columbus community, and I fell in love with this. I was able to meet people before any health exasperations, and I was able to intervene and truly change lives. And so that experience made me realize how powerful community-based healthcare is and how I could become an investigator who co-creates solutions rooted in the community. And so in addition to my work as a PhD candidate, I'm also the founder of Black Health Explained, a nonprofit organization focused on improving health literacy and diversifying the healthcare workforce. I started this initiative while I was in undergrad at The Ohio State University after noticing that there was an influx of misinformation on social media. And I'm sure, as you all know, young adults get most of their information on social media. And so I realized that I needed to use my expertise to provide accurate, engaging, and understandable health information. And so my team and I, we weekly post infographics and videos on social media, breaking down health information in a way that's relatable and understandable. And we also write blog posts and have a podcast where we bring in guest speakers to discuss various health topics in a way that young adults can relate and understand. And we didn't stop there. We also launched Policy Explained, an initiative where we break down healthcare policies in an informative way. You'll be so surprised at how many adults are ignorant to how policies influence health. And so we created this bill tracker on our website where adults can put in their zip code and see what bills are being made in their areas and how they can advocate for these initiatives. Thank you. I'll just close by saying this has been a labor of love. I've personally sponsored this initiative with my limited college funds, but I do this because I'm so passionate about this and I'm willing to commit my own resources behind it. Thank you.
There are a lot of investors in this room, so please meet Faith after. I'm Representative Diamond Staten-Williams from North Carolina, so I can point to 3 specific instances. The first is why I went into healthcare. So my mom suffers from a significant mental health condition, and I remember being maybe about 7 years old, and she got sent home from the hospital. She was suffering a miscarriage. And I remember like walking through the house, like, where's my mom? She was in the bathroom, bleeding out. And I remember having to run and try to find somebody to come help. That's why I went into healthcare. It's why. It's my passion. It's why. Because oftentimes, for kids like me, there's nobody. And we have to be in those positions. So the second instance was after I became a nurse. I was working on the cardiac unit, and I was telling this story earlier in another panel, and working with a first-time mom. She was 18 years old, had been recently diagnosed with lupus, and came into the hospital with cardiomyopathy. And her not understanding what that meant, and having to explain that to her and to her family, what that meant. Like, your heart is failing you, and we have to figure out a way to help you and reduce the barriers to care for you. And I remember taking care of her intermittently throughout a year before she turned 19. And before she turned 19, she passed away. I remember performing CPR on her and knowing that this is, my son will be 18 next weekend, and I was pregnant with him at the time. Knowing that she has a child out here without her is why I keep going. And then this last one is a personal for me. Again, my son will be 18 next weekend. I had 3 C-sections. He's my 3rd C-section. But I remember being on the operating table to get my C-section for him. And again, I've had 2 C-sections before. I know what it feels like to have an epidural. I know what my breathing pattern should be. And plus, I'm already a nurse at this point. Like, I know what's supposed to happen for me. And I remember feeling, I can't breathe. I can't breathe. And I said it to my anesthesiologist and his assistant, and they were like, you're fine. I'm telling you, I can't breathe. I can't breathe. No, it's not even that high. I'm telling you, I can't breathe. I'm laying on this table and I can't breathe. Until my doctor, who was a Black OBGYN, walked into that room, they did nothing. Just imagine if she hadn't walked in. Correct. Because I don't know what I'm talking about. And I'm advocating for myself. And mind you, I'm a nurse. And I clearly tell people, especially if I'm having a procedure, I'm a nurse because I'm going to be watching. Because I have to make sure that I get out of here to take care of my family. And so those experiences along the way have helped shape how I feel about healthcare, have shaped how I advocate and push for different things in healthcare, especially as it relates to mental health care, as it relates to pregnancy, as it relates to cardiac health, because I know all too often at different points in the system, there's a breakdown and people will not listen and they don't advocate in the ways that we want them to advocate for us. So for me, being a Black nurse, we have to stand in the gap. And there has to be more nurses in different places, in different spots, especially as I look in our labor delivery units, where all too often there are very few faces of color. We have to make sure that we're standing in the gap for each other.
Thank you so much. Wow. I didn't know I would almost be holding back tears up here, but thank you for sharing your personal stories, and already thank you to each of you for giving us a glimpse of your journey. I'm going to apologize in advance because I can't hear you describe this work and not deviate from the questions just slightly. And so, originally I thought about asking you all about the barriers that you're seeing women experience and the challenges as they seek care, either directly by what you provide or advocate for. But I feel that is important to share with this audience, perhaps, the challenges and the barriers that you experience in trying to be advocates and trying to offer care. Because oftentimes what we know is that there's silos throughout the system. There are silos as it pertains to getting this access. And so if you could, please also share what are the barriers that you're experiencing in trying to be advocates for women, for Black women in this Black maternal health space. Jump in any order, please.
I think first and foremost, when you say Black, that's your first barrier to them. But I wake up Black every day, so I don't get a choice. That's a barrier. It's like, are you listening to my voice? I'm going to always come from the community because I am the community. I'm not exempt. Any one of these things have or could happen to me. So I am the community. And so valuing community voice, although now we do listen to the lived experience, but I still feel like we have a long way to go with that, because just putting somebody up there to hear their story to make the people feel something has to be more than that. Because I can get up here and make you feel something, but what will you do when you walk out the door? So that's a barrier in doing this work and understanding at this point, we keep funding the problem. When will we fund the solutions? Mm-hmm. So as someone who, as we say, out here in these streets, I know and I see what it is that people not just need, but also what they want. And understanding that those two things are interchangeable. They go together. You need to choose one over the other. People want to feel good. They don't want you to be dismissive, one, of how they feel about things. We're so into being dismissive of feelings. Or just giving people what we feel like, oh, this is what you need right now, so don't tell me about what it is that you want. But how will I get my mental focus back if I'm not getting something of what it is that I want amongst what it is that I need? We're going to always need something. But that's a barrier. I think that how we see people when they are in need, I always say, remember, you could be the one sitting across from somebody's desk needing help. You got to treat people the same way you want them to treat you, because it just simply could be you. But that's a barrier, really understanding when folks like myself talk from a community perspective, that we are just as an expert as those who are doctors, nurses, we all experts because we all have a part to play in this issue in which we are working to resolve. So it's just really understanding and respecting us all in the role that we have to play and dismantling the barriers, honestly, that we have amongst ourselves doing this work.
I think there's a barrier in the trust that the Black community has. First of all, there's a history of medical exploitation and discrimination that has caused deep-seated unease and untrust for a lot of us, especially with our counterparts. And I think that if we can help to remove those barriers so we can increase the number of people that look like us, then that would enable more of us to feel more comfortable to go and seek the medical care that we need. I know that when I was in dental school, I went to Howard, and there were, at the time, 2.5% Black dentists in the United States. It's only increased to 4% 25 years later. We have got to figure out how we can get our young brothers and sisters into medical school. Let's see what the barriers are. Don't let it be because of where they live or how they grew up. Let's get them what they need in order to get to where we need them to be so we can have more people that look like us and we can feel more secure and comfortable seeking the help and guidance from the doctors and dentists and other professionals.
Dr. Scott, let me add on to that then also, once you become a provider, as challenging as it is, there's very little education on trauma-informed care. Right. And so when the providers, even some of our Black providers, come into an environment where they're dealing with someone who is traumatized for whatever reason, that lack of understanding is not there. And it's very challenging for that patient, that client, to present themselves in a way that they're believed, that they're understood. And so I think if we did a better job in medical education of doing some trauma-informed care, that would be one huge step towards understanding the patient that you're taking care of.
Mm-hmm. So at Johns Hopkins School of Nursing, we conduct a number of community-based projects, and one of them is called the Safe Heart Study, which is funded by the American Heart Association and led by the wonderful Dr. Yvonne Commodore-Mensah, who is in the crowd with us. And with this study, we were interested in learning what are more about these social barriers that women of reproductive age specifically face. And so we screened over 250 women in the Baltimore and Washington, D.C. area, and I have some compelling or startling statistics to share with you guys from the data that we've analyzed. This is hot off the press. We're hoping to publish this manuscript soon, so you guys will be able to read about this more. But what we found is that 72% of the women mentioned that it was hard for them to pay for housing, medical care, and heating. 23% are uninsured. 30% have unstable housing. 56% are dealing with housing issues such as mold, pests, and major repairs that they need in their homes. Additionally, 67% said they're worried about running out of food and they don't have money to pay for more. 46% lacked reliable transportation. And even more concerning, 37.3% said they had their utilities were threatened with being shut off, and 30% felt unsafe in their homes. We've talked about a lot of social barriers today, but we have not talked about safety and how things like intimate partner violence and other violences that women face may be impacting their maternal health. And so there are so many challenges that really requires investment from our health care systems. And so funding community-based initiatives like the work that we're doing is really important so that we can provide screenings, vaccination, and preventative care without the need for them to take long trips or take time off of work. But then also, most importantly, we need to start by asking these right questions. Asking your patients, do you have transportation for your next appointment? What's your housing situation like? These simple questions are often overlooked, and it can open the door for providers to understand the barriers that patients face and intervene early. They also allow for providers to tailor their care to each patient's unique needs, ensuring that women receive the support that's necessary to overcome these barriers and access the healthcare that they deserve.
My answer is simple: money. Money's the barrier, whether it is paying to get an education, getting out of school with the burden of student loan debt, period.
Yes.
Paying for housing, car, food, shelter, all of that. Money is a barrier. And how we disperse money as a state, how we allocate money as a state, as a federal government, is a barrier. Who's holding the keys to the money is a barrier. If we don't have strategic thought and strategic voices in the places where it matters, money will always be a barrier.
Yes. Thank you all so much for that. Dr. Scott, you gave a very interesting perspective in talking about trust and access to care. And, this next question is specifically for you. And that is, there's been clear evidence that proper oral health care is a critical part of comprehensive pregnancy care. Yet our health system treats it as optional. Black women are disproportionately, again, impacted by this, with overall health consequences for both mom and baby. Can you speak specifically to what changes need to be made to ensure both better access to dental care before, after, and during the pregnancy?
Yes. So I am, of course, not in the OB room when the mother-to-be is there, so I'm not sure of the conversations. But in doing some research, I believe I saw about 48% of women continue on with their dental care while they are pregnant, and that decreases 14% more for Black women. It is so critical that we continue to visit the dentist while we are pregnant. It is so important that a lot of insurance companies have increased the number of times that you can visit the dentist and have your teeth cleaned. If you can even get gestational, gestational gingivitis. I'm going to say diabetes. Gestational gingivitis, which is inflammation of the gums, and then that can progress on to periodontitis, which then releases, it has bacteria that releases into the bloodstream and gets through the placenta, causing low birth rate and stillborn, and it can affect the mother as well. So it's so important. I think that conversation needs to be had, maybe a checklist when the patient first goes and visits the OB, to tell the patient, please, do you have your appointment for the dentist? When a pregnant patient comes in to see me, we always send a medical consult form to the patient to go and take to their OB. I have never once gotten one back where they told me I could not do whatever I wanted to do. I can take x-rays, I can give anesthesia, I can do whatever procedure that I need to do. So there really should not be that barrier in keeping the dental health where it should be. So all the physicians should be having that critical conversation with their patients and inform them how it's important to continue on, or to start, if they haven't been, with their dental oral health.
Thank you so much. I want to dive a bit further into where we started the conversation. I've heard trauma-informed care mentioned. I've heard the mental health challenges mentioned. I'm really curious now that organizations, churches, and community leaders
have really been trying to find their own methodologies to shed light on mental health access. If you all have any perspective on how we can better support mental health specifically for Black women, oftentimes when you're experiencing your challenges, you don't want to put your business out there. You don't want to turn to someone and tell them, what your private needs are. But what could we do considering societal pressures and systemic discrimination to try and resolve this area around getting mental health care while you are in your birthing process? Anyone can jump in.
One of the things that at Anthem we are really trying to focus on is helping our moms, particularly those who are having a high-risk pregnancy, get wraparound services that include mental health care. So one of the things that we're looking at is realizing that life skill building is often an ignored part of mental health care. And it's simple. Some folks just need a little extra support just to understand the basic process of how to get through life, much less how to get through life with a pregnancy that may be considered high risk, or just dealing with little kids while you're pregnant. And so hopefully with our life skill building program, we're looking to engage moms with, I want to use the word challenges, but it's not the right word I want to use. But who could use the support? Who would be able then to make their doctor's appointments? Who would be able to make sure that their bills are paid so they have stable housing for their children, to make sure that they're taking their medication, to make sure they recognize the red flags that might be going on with their health, so they know to go ahead and reach out to their provider, or even to have that skill building coach go with them to the provider to advocate for them and teach them how to advocate for themselves. So I think that's one way that Anthem is really trying to embrace this idea of trauma-informed care, making sure we're speaking to the clients in a tone that is respectful, in a way that they feel empowered, in a way that will help them realize that they are indeed supported by their insurer.
It's also important to understand the levels of care that people need. Some folks just need a support group. Some people need to talk to a therapist. But when we talk about trauma-informed care, then it really comes down to understanding the person that is presented in front of you, and there's no one-size-fits-all approach. And that's often the care that we get without it being centered on actually what my needs are. So the way that we serve actively is in 3 tiers. The support group, because I may just need somebody to talk to. I'm good, but I need a little support system, maybe somebody I can bring the kids and meet at the park or something like that. Or maybe I need a licensed clinical social worker because I got some other things that are going on as well. So we bring that into the fold. And then we've created actually our own culturally responsive screening tool. So everybody that comes into our organization gets screened, not just once, you get screened the lifespan of your services from us. Because what I need today may not be the same, how I feel today may not be the same a couple of weeks from now. But what the screening tool does is it helps us to individualize the care that we are offering to the individual that we are serving, inclusive of their families. So for me, the mental health focus has to be on what does this person individually need for themselves as a continuum, not right now, what do they need in the long term? And it could be all 3. And so because we have all 3 of those systems in play, but it's catching people where they are, getting them to understand, educating on a level where keeping in mind that everybody does not learn the same. You may have to present that information to them in different ways. But just simply as a community, how we look at mental health, our biggest holdback is the stigma that is associated with it. And until we can get to a point where we destigmatize it in a way where people understand that it is okay to not be okay, but it's not okay to stay there. And that's the part we cut off.
I want to piggyback on what she's saying. I wholeheartedly agree. And I think that our leaders, whether it's in the community leaders, the representatives, the church leaders, I think they need to get out there and they need to let anybody who is listening know that it is okay. Just like she said, it's okay. It's okay to get help. It's okay to ask. It is okay. And I think that because of the stigma, people need permission to go out and seek that. They don't want to let anybody know they're scared. They don't think that it's okay. So I think that the leaders should be able to tell everyone else that it's okay if they seek whatever help they need, in what capacity.
I really echo everything the panelists have said. There's a mind, body, and heart connection. And so when we talk about mental health, it does not occur in isolation. Amongst the same women that we screened, we asked them questions about their mental health, and we found that over half of them had high stress, had high depression, and over 40% of them had high anxiety. And when we looked at this further, we saw that amongst these people with high psychological health conditions, we see that they had elevated blood pressure, elevated blood sugar, were more likely to be smokers, and other adverse cardiovascular risk factors. So these problems are interconnected. And so what can we do? We need to sponsor programs that provide women with access to evidence-based approaches like mindfulness, like yoga, physical activity, and in making these things more cost-effective and accessible. Thinking about how we can put these things through mobile apps or in-person classes or digital platforms are some solutions that we could really consider. For our phase 2 of the study, we're focusing on Hispanic women. And what we're finding with Hispanic women is that many of them face the same social risk factors, but their health outcomes are much better than other counterparts as it relates to cardiovascular health. And we believe, or one theory that we have, is that the support that they have from their intergenerational communities are helping them mitigate some of these risks. So how can we make sure that Black women are supported and are not going through these things alone? Because this can help mitigate some of the challenges that they are facing if we can create these support groups, whether it be digital or in person.
Yeah. And I echo everything everyone has said. I would also like to add peer support. Oftentimes people do very well seeing someone else with a similar condition, such as you do better when you see someone who's successful and you see someone managing and someone who's able to relate to you in a different way because they've been there, they've done it. They may have come out on the other side, or they still may be going through it a little bit, but still have support. But knowing that I can talk to you and you relate to me, you look like me, and I can talk to you about things that if I come to Maryland in Alabama, she may not understand. I'm able to talk to you in a different way and have that empathy and support that oftentimes we don't get when we are by ourselves and outside of community. I also like to add in that 4th trimester. So the 4th trimester is a big thing. So that's after you've had that baby. What is the care that you're getting? How are you getting connected to other communities, whether it's a peer mom or just an app? I've got involved recently with an app called Love Evolve, which provides digital help where you get an email every day or you get a text from the app every day to say, how are you feeling? What's going on? Let me connect you to a resource if you need it. Something that's simple that you can control by yourself sometimes is a good support. And it also gives you tips on how to take care of the baby afterwards. Oftentimes that's what people truly need. And it is a variety, whether it's a psychologist, psychotherapist, whatever you need, we have to be able to help support and provide the funding to keep it going.
Thank you so much. Can we please just thank them again for these responses? Thank you. As we close out this panel discussion, we've talked about building trust. We've talked about where our mouths are and funding the solution and not the problem. We've talked about trauma-informed care, utilizing the resources that are before us. It's not every day you get a room that is filled with policymakers at every level of government, doctors, practitioners, every individual across the spectrum that can affect this issue. And so I just want to close out by saying, is there anything we haven't heard yet? You know, have we talked about and offered every recommendation that everyone who has the power to do something in this room can leave with. You might not get another moment like this to talk to that doctor that you need to be seen and be heard and understand why this issue is so critical. And so we are at time, but if you have a 30-second response, that is 30-second response, that is, this is the recommendation that that policymaker needs to leave with, that that provider needs to live with, that hospital CEO, that advocates, what do you have to offer them?
People are no longer suffering in silence. They are suffering out loud. Get educated so you know how to catch it and help them.
Thank you.
I agree. Educate and educate early.
I would say take care of your providers, not only the physicians and the nurses and the healthcare providers, but all of the community providers who are there doing their hard work and sometimes even going unrecognized. Take care of them.
I would say fund community-based organizations. These organizations know the people and have direct connections. We just need the money and support to do the work that we can do to solve these problems.
Open your doors. Open your doors to listen. Listen, listen, listen. You have a panel full of advocates that are here. Open your doors to listen. When they come to knock on your legislative door, open the door. When they come to Blue Anthem, open the door. Open the door.
Thank you so much, ladies, for all of your amazing responses. Thank you.
Let's please give it up again for our panelists. Thank you all so much for sharing your expertise, and of course, Senator Aaron for moderating. And before I turn the microphone over to Kenny, I want to recognize a few folks. I would first like to recognize the Mayor of Richmond, Mayor Lamar Stoney. Thank you so much for being here today. And Congresswoman Abigail Spanberger is here with us as well. And before I turn the microphone over to Delegate Monday King, I would like to first have Leader Herring come up. Or any members of the House Caucus.
This has been such an amazing two-day event for all the participants, for those who are here. Thank you for what you have done. And, you know, behind any kind of event, it takes a lot of planning, a lot of talking. And we're just so honored to have the face of this event, none other than Delegate Candy Monday King. We're going to ask her to come up. She has been so amazing. Yes. She has been so amazing in her efforts. We are so grateful for her making all of us shine. And that's what has happened this week, yesterday and today. So on the behalf of all of those of us who are here, we want to say to you, thank you for being so absolutely.
And we also have speakers from, flowers from Speaker Scott and his staff. So Dr. Scott has those flowers. Thank you.
Thank you so much. Yes.
Thank you all so much. That was truly a surprise for those sitting around me. I said, what is happening? Because I do keep very tight control over the things that are happening. And I'll talk a little more about this later because my colleagues are so gracious, and I'm always so grateful to be recognized and all of that. But this is not me. It is truly we. So everything that you see here today is an entire team effort of people who are doing the work, and I'll be acknowledging them in a little bit because right now we are a bit behind and we need to get through this schedule. And to do that, I want to bring up the mayor of Richmond to give us a few words. Mayor Stoney.
Well, good afternoon, everyone. I know we've had some lively discussions, some informative discussions, and I want to thank Delegate London King for inviting me to say a few remarks on behalf of the great city of Richmond. I have 75 days left here in office as the mayor of the great city of Richmond. And when you find yourself at the tail end of your time of service, you are very reflective. I can only imagine when my time comes how reflective I will be. But I'm very reflective right now, but I want to reflect on one thing. It's one of the most special moments of my life recently is that I was able to join my wife, Brandy, on her journey, her birthing journey for our little girl, Sunday, who was 7 months old. And I went to every appointment, and I was there for the birth. And what an experience. But also what was stated by this panel that just preceded me, I experienced and saw some of those microaggressions. And one that sticks out to me is after the birth, the doctor tells you that she is a little orange. The bilirubin is too high. And for a person who just gave birth only probably hours ago, my wife was obviously just broken up knowing that we would have to put her under the UV lights. I don't think my wife wanted to separate at all at that time. So tears flowed. And the doctor, I think, could have been a little, the bedside manner wasn't fully there. So she rolls back in and she says, okay, so what did Dr. Google say? And you know, my wife was ready. She said, well, first I know about your credentials. And I was like, okay, I'm trying to be, supportive, but also recognizing I'm a politician as well. But I let my wife go. Because that is not the way to treat a person who just gave birth to a new life. And I had to only think back to the number of microaggressions we experienced along the way to think, I wonder, is this happening to someone else who does not look like us? I know I'm preaching to the choir, but in 2024, women should not be dying due to preventable causes during perinatal period. And by God, Black women should not be 3 times more likely to die than white women. So I want to thank Delegate London King, Senator Lucas, Speaker Scott for taking the initiative to address such a critical issue at this level. Important work has been ongoing in communities all across the Commonwealth. And I know many of us who work at the local level are grateful to see this issue elevated as a state legislative priority because Virginians deserve it. That's why Black maternal health has been a priority of our administration these last 8 years. And we are just showing and just demonstrating what can be done at the local level. In 2018, I directed the administration to double the amount of time available to the City of Richmond employees for paid parental leave, amongst the highest in the Commonwealth. The next year, Richmond became the first city in the South to implement a lactation policy for our employees. And then in 2019, after conversations with community members, practitioners, advocates, I directed our administration to partner with the Richmond Henrico Health District to convene the Greater Richmond Regional Maternal Child Health Collective Impact Task Force. That's a mouthful. But this task force brought together a diverse team of stakeholders and helped us identify holes in support and care and implement solutions. In response to the task force's recommendations, my administration included maternal health equity in the City of Richmond's first ever equity agenda, adopted by the City Council in 2021, post the reckoning after the murder of George Floyd. Later that year, the City Council voted to approve my administration's spend plan to share our American Rescue Plan dollars. And that plan included a $5 million to establish the first ever in the Commonwealth of Virginia Health Equity Trust Fund. And we used $2 million of that to support expanded access to child care and other supports for caregivers and young children. Since 2022, the support of ARPA funds, the city of Richmond has been able to enhance training and education for community doulas in the city, expanded access to direct doula services for Richmond residents. We provided comprehensive doula care and peer support for birthing people at the Henrico County Jail, the Richmond City Justice Center, and the Richmond Behavioral Health Authority. We ensured that families in need had access to diapers and safe sleep spaces or car seats and strollers. We expanded access to home visiting services for pregnant women. We supported the development of web-based birth and early parenting resource directory. And we opened 4 new child care centers and added over 250 infant, toddler, and preschool slots for our children. Yes, our residents have benefited from the ARPA plan, but more importantly, they benefited from the city's of Richmond's partnerships with community organizations that do this work every single day. Community organizations like Birth in Color, Urban Baby Beginnings, Virginia Prison Birth Project, and Mommies, Babies, Bellies, and Daddies. Yeah, I got it right, right? It's a lot of. Together, we supported not just our residents, but Black women who are at the forefront of the fight to close the maternal mortality gap and keep Black women alive and to and through childbirth because of the impact we've made in Richmond. Thanks to the leadership of many of you here today, we work to ensure that the city will sustain these efforts beyond the use of our ARPA funds. So, in our past city budget, our fiscal year 2025 budget, we invested an additional $500,000 to continue the work of the Health Equity Fund and an additional $1 million to expand access to high-quality childcare and preschool programs here in the city. In addition to these investments, the city of Richmond has worked to protect access to abortion and reproductive health care after the Dobbs ruling in 2022. Just this summer, the City Council approved my proposal to transfer a school building, an old school building, to Planned Parenthood to pave way to a new health clinic in Northside, a healthcare desert in our city. Folks, there's always more that we can do, but we can't do it alone. We need bold, courageous, and visionary leadership at the state level, grounded in the conviction that we can together end the Black maternity mortality crisis once and for all. Virginia should be on the forefront of Medicaid innovation. Expanding Medicaid in 2019 was a start. Thankful for all those in this room. Expanding coverage in 2022 to include community doulas services was a critical step in the right direction, but there's more than we can do. We must ensure that pregnancy-related Medicaid coverage continues to extend through the entirety of the postpartum period as defined by medical experts, not legislators or budget analysts. We should explore how Medicaid can support culturally responsive and community-based approaches to perinatal health care, and we should consider how Medicaid and other funding sources can help expand access to vital home visiting programs that promote maternal and child health. Virginians also must have access to paid family leave. And we must protect every Virginian's God-given right to control their own bodies by ensuring anyone who needs it can access abortion care in our state. I am humbled, folks. I'm humbled by the work that you all do. The work in Richmond has been incredible because of our community partners, elected officials, and residents who work alongside us to fight for equity and greater access to care. We have advocates like you who have worked every single day to improve maternal health and address the disparities plaguing Black women all across the Commonwealth of Virginia. So I'm here to say thank you for your collective work, your advocacy, your policy changes, your direct care for pregnant Black women. It's all incredibly important, and I have you to thank. Thank you so much.
Thank you so much. And so we are at our closing point. And we have a few folks that I would love, if you can, to stay and pay close attention to. You'll regret this later if you miss some of these speakers. You'll look at them on CNN in a few years, and they'll be running for big things and doing major things. And you'll say, I missed their speech at the Black Maternal Health Legislative Summit. So please stay if you can. I will ask our speakers, as you can see, we are treading on a little over time, so to please be as brief as possible. As nice and kind as the governor was a little earlier, his staff does expect to have their space back by 3 o'clock. So next up, we have someone who is so near and dear to my heart, feels like a missing, sister, Veronica Robinson, who, if you all are like me and was obsessed with science and was very surprised to learn that the modern medical marvels of the last 50 years came down to a beautiful, beloved Black woman named Henrietta Lacks, whose story we know, but whose legacy we're still being impacted by. And so I have one of her legacies here with us to talk about Kilo 100, the Henrietta Lacks Initiative. So please join me in welcoming Veronica Robinson.
Good afternoon, everyone. First, I want to thank the speaker, Dawn Scott, Representative Candy Munding, who is also like a sister. She showed me that yesterday when she showed me out. Chairwoman Karen Camper, Jasper Hendricks, and the Black Legislative Leaders Network for their foresight in bringing this timely convening together. It's an honor to stand amongst leaders committed to taking action to improve maternal care and equity for birthing people, mamas, their babies, and families around the country. Last night and this morning, as I sat and listened to your incredible stories, I thought of my family stories. Not just the stories of trauma and pain, but the stories of hope, resilience, and the determination to be seen and to be heard. While bearing witness to our stories is vital because our pain is real, I watched as our elected officials shifted to solutions. You didn't just sit there. You are taking action to create legislation to make changes our mamas, babies, and families desperately need. I know my pop would have loved to be here with us because, let's be real, he loved when things were actually getting done. What better place than here in our Henny's beloved home state of Virginia to bring together leaders from around the country ready to make things happen. After all, this month marks 73 years since her passing and the Halo Cells announcement. I'm the great-granddaughter of Henrietta Lacks, the granddaughter of Lawrence Lacks Sr., Henrietta's eldest son. I stand here not only as a reminder of her remarkable story and her impact on science, medicine, and patient rights, but also as someone who is deeply invested in our future. Her legacy is not just about the past. It's about how we carry it forward to take action and create a better future for the next generation, our children and grandchildren. It was my grandfather who watched his mother suffer in silence while pregnant, a silence that many of us in this room know all too well. My family, like many of you, went through our own journey, led by the matriarchs like Lawrence Lack's wife, Barbette, my mom, who cared for Henrietta's motherless children, aunties like Deborah, who kept asking questions about her mother she never knew, and uncles like Sonny, who continued to tell the world our story. Our Henny in life loved to help others, and in death, she continues to touch lives worldwide, advancing health equity and contributing to scientific breakthroughs that benefit us all, from polio, IVF, cancer, HIV, COVID-19, and precision medicine to diversify clinical trials. Now, as the next generation, our family continues to work tirelessly to ensure that the world say her name. We became the narrators of our own stories. We push for justice for Henrietta, and we advocate to ensure that no other mothers needlessly dies. That's why my family truly believes there's going to be nothing nothing about us without us. I am proud to be here today as a member of Fund 2 Foundation for Black Maternal Health Equity Project. I serve as on the policy task force and collaborate on Nurture Her Black Maternal Health campaign. This afternoon, as I rose to speak, I thought of the executive director, Linda Wilson, often reminds us, we know the facts, we live the stats. Because just as many of us have come to know the story of Henrietta Lacks, we here today know about the Black maternal health stats. Today, women have less rights than my great-grandmother Henrietta Lacks had. We have the data. We can no longer admire the problem. It's time for action. We can't wait. The maternal health crisis continues to devastate our communities, particularly for Black women. But what gives us hope is you. This is the room where it happens. We have information, tools, and resources right here in this very room to make the change happen. Over the last 2 days, I watched you reach across to each other and build collaboration. I urge you to use the resources available to continue to reach across the aisle, across the community, across organizations, and to take bold steps to introduce and pass legislation that will address maternal health disparities head on. Lives depend on it. We must use our collective powers to advance legislation, tacticals, and root causes of mental health disparities, inequities, and barriers. We must focus on equitable access to care, community-based solutions, and comprehensive support for mothers and birthing people. We are proud to stand in solidarity with all of you, legislators, advocates, patients, survivors, thrivers, warriors, and families, raising your voices, just as we have done for our beloved Henry. We must ensure that no other mother, sister, daughter, aunties, friend suffer. And not just suffer, but suffer in silence. And that everyone has access to maternal care. Each time we build upon her legacy, as we leave here today, remember, Henrietta Lacks' legacy lives on in all of us. Each time we lift our voices to speak truth to power, listen to mothers, and enact policy solutions that ensure all mothers thrive, we honor Henrietta's legs sacrifice. As we return home, let us make action our legacy. We must leave here today not only inspired, not just inspired, but determined to implement policies that directly combat maternal health disparities. We can dismantle the maternal health crisis. I'll say that again. We can dismantle maternal health crisis. We can create communities, states, cities, and counties that provide access to prenatal and postpartum care. Invest in the community health workers, midwives, and doulas. Listen to moms and dads and families. Uphold transparency and accountability in the healthcare system. Address implicit biases in healthcare. Protect birthing rights. Provide paid family leave. Ensure affordable quality child care, and prioritize maternal mental health. Together, we can do this. We must legislate for change. In doing this, we honor Henrietta Lacks, the mother of modern medicine, but we also honor all moms. Thank you.
Thank you so much, Veronica, and thank you for reminding us of the mother of modern medicine and keeping her legacy alive. Next up, we have joining us from Washington, D.C., Congresswoman Abigail Spanberger.
Thank you for inviting me to join you today. I'm Abigail Spanberger, and I am so proud to represent Virginia's 7th District in Congress. And Delegate London King, thank you for inviting me to speak. And thank you for everyone who is responsible for putting together this conference on this vital, important issue. I want to thank Speaker Scott, and Senator Lucas, Delegate King, and the entirety of the Virginia Black Maternal Health Caucus for putting this event together, highlighting this issue, and bringing people together to talk about maternal health. No mother should have to fear dying during or after childbirth, and no child should ever endure the pain of losing their mother to an avoidable death. And it is unacceptable that in the United States of America, a Black woman is 3 times as likely to die from a pregnancy-related issue as her white counterpart. And throughout my time in Congress, I have been focused on combating and addressing this crisis. And Mayor Stoney spoke well of some of the work that localities have been able to do thanks to federal dollars through the ARPA funds. I've worked to try time and time again to reauthorize and fund the Pregnancy Assistance Fund to help community entities. But importantly, I was most honored to be a small part of the work that is done on the Momnibus Act. So I am a member of the Black Maternal Health Caucus in the United States Congress. And as a part of that caucus, we introduced, under the extraordinary leadership of Congresswoman Lauren Underwood of Illinois, policies that embrace culturally competent care. We have to acknowledge systemic biases in our healthcare system, and we have to improve access to quality pre- and postnatal clinical and behavioral health services. These steps are critical to improving health outcomes for Black mothers across the country and, of course, here in Virginia. And furthermore, each year, hundreds of thousands of women across our country experience the heartbreaking loss of a pregnancy due to miscarriage or stillbirth. And Black women are nearly twice as likely to miscarry or have a stillbirth. And the last thing that anyone should have to worry about when they face that tragedy is the shock of unexpected medical bills. Yet, because of a legal loophole, while for many insurers, pregnancy care is compiled and the family receives one copay for the entirety of that pregnancy, if that pregnancy doesn't result in a healthy living child, every single ultrasound, every single doctor's visit can be billed individually, one by one by one. And I'm aware of this issue because a constituent called me and said, this is something I'm facing, and the financial burden of it is one that I can bear, but I cannot imagine the reality that this must be for people who are facing bill after bill after bill in light of such a family tragedy. And so on behalf of the women who have faced this unjust situation and circumstance, I've led a bill called Caring for Grieving Families, and this legislation would make it absolutely illegal to unbundle pregnancy-related services from what had been a single co-payment. It's a process that is leading to higher than anticipated costs for those who experience the heartbreak of miscarriage or stillbirth. And in addition to this legislation, I've supported and voted for legislation that would increase research and funding for stillbirth and miscarriage prevention, recognizing that it is a tragedy for every family who wants nothing more than to bring a child home, but we know that the rates continue to even be staggering in the differences between Black women and white women. And so looking to the future, it's important that in Virginia, as we look at these disparities and we name them firsthand, we need to define for all of us here in the Commonwealth what it means to live in a Commonwealth where currently we know that Black mothers die more often than white mothers, that children are left families that are broken, that are grieving, and we know that there is much more work to be done. We know that if Virginia is going to become a leader in helping mothers and their babies thrive regardless of race or zip code or paycheck, we need to address this challenge head on. And 30% of women in Virginia live in what's called a maternity care desert. 3 out of every 10 women live in a county without an obstetric provider and without, in many cases, access to a hospital or a birth center where they can get the care they need. And these maternity care deserts, they have real consequences. Women are forced to drive long distances, sometimes for hours for that care. These journeys increase the risk of tragedy, and they impose incredibly high costs of stress, financial strain, and sometimes result in miscare and disappointments on those families. In the year 2024, it should not be a luxury to have a provider in your community. It shouldn't be a luxury to give birth in a safe environment. And that's why we must continue to invest in our maternal care workforce, from OBGYNs to nurses to community health workers to midwives to doulas. We must continue to address this crisis by building out the maternal health care workforce. And I thank everyone who is part of this mission. We also know that insurance coverage plays a central role in equitable care. And while I am so proud of the coverage that our Medicaid program here in the Commonwealth currently provides to mothers, we can do better. Every woman in Virginia deserves access to safe, affordable, comprehensive care. And that means making sure we have adequate, continuous coverage and follow-up care for mothers and for families. And we need to take care of vulnerable people through this Medicaid program. Mothers at risk of domestic violence, mothers grappling with addiction or substance use disorder, and those without a steady roof over their head. Additionally, we need to continue to care for mothers after they give birth. One area where Virginia lags behind many other states is in screening for postpartum depression. In some states, it's a requirement. In some states, it's a recommendation. In Virginia, it is not. We need a comprehensive approach that makes this screening more a regular part of pregnancy and postpartum care so that we can provide mothers with the assistance they need. And we must ensure, as Representative Williams from North Carolina said, we must ensure that people on the ground with on-the-ground expertise have a voice in policy making, and that policymakers are listening. The people who are in this room today represent community members, experts, providers, legislators. And so many people in this room have profound experience and a perspective that can impact the work that is going on here in Richmond, in your state capitals, or on Capitol Hill. And it's frankly because of the tireless work of everyone here that Virginia will be on that positive trajectory. We will ensure that our most vulnerable neighbors are taken care of, and we will ensure that we are uplifting every family in Virginia. And we will ensure that in the years to come, while there will still be important work to be done by this caucus and at this conference, that year after year, those disparities, those numbers will change. Because I want to see a world where we are celebrating the fact that we identified a problem, we identified a reality, we identified the truth and the situation facing so many families, and we said it's no longer something that we can accept here in Virginia or anywhere in our country. And so it is my great, great honor to be with you all today, to thank you for the work that you are doing as we all work to ensure that every woman, and particularly Black women, can feel safe, supported, honored, respected, and joyful in what should be the most extraordinary experience in their lives, and that's becoming a parent. Thank you.
Thank you so much. As we all know, showing up is an important part of the job. So we're so grateful to you, Congresswoman Spanberger, as well as Congresswoman McClellan and Congressman Scott. You see, we are very fortunate here in Virginia to have members who show up for their communities. And so for the final group of speakers, and then we are going to end with Senator Locke. I would like to ask you to come up to the table and to keep your remarks to 2 minutes. And so that is Senator Tanya Anderson, the president of Nobel Women, representing over 300 Black women elected officials. We have Dr. Leah Alexander from Meharry College of Medicine. And I just have to say, I don't remember the percentage, but I was telling someone that I've never had a dentist that did not go to Meharry or Howard. And that is just a testament to HBCU medical schools. And then Melissa Hurd, and then Erica Shoemate. And we will start with Senator Anderson, and everyone else can have a seat here. Okay.
Thank you so much, Delegate Candy King, Munden King, along with the entire Virginia Maternal Health Caucus of beautiful Black women. Thank you for this extraordinary opportunity to address you. I promise to be brief. I text Candy and said I just cut down my comments. But good afternoon, everyone. It is great to leave the state of Georgia for 1 minute. 1 minute, because I got to get back to the voting process. To come and say hello to the wonderful people of Virginia. I am Senator Tanya Anderson, and as president of Nobel Women, affectionately known as, we are in 37 of the 50 states, and we are 380 plus women strong and growing. Yes, we are. Growing so much that we are about to be the commander-in-chief. You heard me. Say, we are about to be the commander-in-chief. So everybody needs to get used to us being in this public policy space. Just get used to us. As president of Nobel Women, I began this presidency in January, and under my leadership, I have chosen and been given by God the theme equity and justice. What? Yes, equity and justice. Racial equity, education equity, specifically concerning our HBCUs, economic equity as systemic issues with its intentionality of creating wealth for some and allowing extreme poverty for others. And finally, health equity, specifically Black maternal health. We've heard the stories and we've seen the numbers, and these numbers tell a heartbreaking story. Black women, and we keep hearing it because it's true, are 3 to 4 more times likely than white women in the United States to die from giving birth, with most of the maternal deaths being preventable. In some southern states, the maternal mortality rate for Black women is as much as 5 times higher. This is a crisis deeply rooted in systemic inequities that stretch from access to quality health care to the social determinants of health, to implicit biases that affect how Black women are treated by medical systems. But this summit is about hope and hope for change, and a belief in the power of the collective action. We've come together today not just to discuss the issues, but to craft a comprehensive legislative strategy that will save lives. From expanding Medicaid, to ensuring maternal care, to ensuring implicit bias training for healthcare workers and providers, and investing in community-based solutions, we are poised to make a real difference. Every policy we develop and every bill we draft has the potential to impact the lives of mothers, families, and communities for generations to come. But let's remember that behind each number, behind that statistic, is a name, a mother, a family torn apart. We cannot be satisfied with incremental change. This is a matter of life and death, and we must act with urgency. As we conclude this pivotal summit, I want to take a moment to reflect on the urgency and importance of the work we are doing here. We've gathered as legislators, advocates, and community leaders to address one of the most critical health crises facing our nation, the Black maternal health crisis, particularly in the southern states where the majority of Black Americans live and give birth. As Nobel Women President and the daughter of strong Black parents and grandparents and many ancestors before, I vow to work with you and for you to reduce and prevent rising rates of maternal mortality, maternal morbidity in the United States and beyond. We will work in our states individually and collectively to implement and urge policy in these areas that matter. As we leave here today, let us carry with us knowledge that we have the power to shift the narrative. Together, we can ensure that every mother, regardless of race or zip code, has access to care and support she needs. Thank you, and thank you all for your passion, your dedication, and your commitment to this cause. Together, we will create a future where Black maternal health is no longer a crisis, but a success story. We will march on until victory is won. Thank you.
So thank you all so much. This has just been mind-blowing today, and I'm just so thankful to be part of the conversation. My name is Leah Alexander. I work at Meharry Medical College. So I just have a few reflections. I didn't, write anything, but I've been trying to reflect over the day. So the first thing is we have to have more healthcare providers, right, that are Black and brown. So I think we all agree with that.
Yes.
But we have to start that sort of pathway early. And so, Meharry does wonderful work. We have these programs with Tennessee State, MTSU, where their students do like 3 years, and then if they're guaranteed to be able to get a seat in the medical school. So other places can do that, right? You must please connect with your HBCUs.
Yeah.
So all, higher education is wonderful. I'm a project of an HBCU. I went to Spelman. Part of being able to be successful is confidence.
Yes.
And so for us, there's no confidence builder like going to an HBCU. So
Yes,
I think
my
that's
God.
just really important to state. So just
Yes.
looking for opportunities to partner, looking for opportunities for those pathway programs. But we have to start even younger than college, grade school, middle school, making sure that students are exposed to STEAM programs. Because the other thing in this whole confidence piece, girls lose their confidence around STEAM, right? Science, technology, engineering, arts, and math. And then they think that they can't do it. So we have to see examples of success. So all the physicians and just the bomb people that have been here today, kids really have to see that. And we have to start bringing kids in and exposing them to the sciences, technology, and making sure that they're confident, right? I feel energized because, ooh, am I supposed to stop? Okay. I feel energized because, you know, Tennessee did not expand Medicare, but I mean Medicaid. So I am energized to go back home and work on that because it's been a long drawn out conversation and it seems like we'll never get there. But this today has sort of energized me. And then the last thing that I will say is just to ask you guys to think about advocacy, right? But think about it in a different way. I know how to advocate for myself most times when I go to the doctor, but if I think about how I learned how to do that, I really don't know, right? But what I've heard over and over again today is that sometimes you have to have somebody to advocate for you, but what about people who don't? So is there something we should be doing with community to teach them how to advocate for themselves so that they feel confident and comfortable? And then lastly, I want folks to think about internalized racism because we have not talked about it today. We've talked about systematic racism and we understand that that limits access and all of those things. But in minority populations, there's also internalized racism. And it honestly makes us think that we do not deserve better. And so I think we need to start having those conversations and combating that with young children as soon as we can. And even with ourselves, right? I think pregnant women sometimes just don't think they deserve the best, and that's a problem. So thank you so much. I just really appreciate being here today.
Good afternoon. All right, I know I'm next to the last person that's holding us from being dismissed. But I just wanted to share, my name is Erica Shoemate. I am a maternal health ambassador for the March of Dimes, or I should say in partnership with March of Dimes. And just wanted to share briefly a bit about why I became a maternal health advocate. Imagine sharing the wonderful news to your family and friends that you are expecting. The excitement of watching your family grow, although a surprise, and hearing from your care team that everything is perfect. For us, that joy quickly turned into the most devastating news of our lives. At exactly 20 weeks and 5 days into our pregnancy and first visit to a maternal fetal medicine specialist, receiving an unimaginable diagnosis. Your baby girl has a lethal genetic mutation that is not compatible with life. Heal, terminate, heal, try again in that order. Then you're advised to terminate not once but twice because if we decided to move forward, our baby would likely suffocate upon delivery and it would be a tragic birth because her chest was too small to support her lungs. And on June 1st, 2017, that is a date that is etched in my memory forever. And it changed the person who I was before that very hour. The trauma changed my DNA forever. I am not the person that I once was. My husband and I were shattered. We spent sleepless nights agonizing over our options, knowing whatever decision we made would be finite. In Virginia, the law dictated that we had only 1 week left to make a decision before the termination ban at 22 weeks. The neighboring state of Maryland allowed for 24 weeks. We were faced with the financial burden of having the procedure as our insurance refused to cover it, even after appeal. This gut-wrenching decision came with a price tag of nearly $10,000 at a hospital or half the cost at a clinic. Despite being federal public servants, me personally, a national security intelligence analyst for the FBI, I've spent time in high threat areas, risking my life for this country. This critical reproductive decision was financially out of reach. But beyond the financial cost, the emotional toll was devastating. As a mother, I was denied the autonomy over my body, forced to confront this tragedy without affordable options, for mental health support as well. Sitting in a hospital room and a doctor giving you this information with no support at your bedside, and having your husband or partner literally left with nothing to do but watch you. That is unacceptable. And also, I fell into a deep depression, as one can imagine. I didn't want to get out of bed. I didn't want to eat. I did not want to be bothered. As a Christian family, we prayed for a miracle, but that decision was not black and white. It was a painful, heart-wrenching gray. And just 24 hours before the scheduled procedure, we canceled our appointment. We chose to carry our baby to term, knowing she would likely die upon arrival, even as going as far as to asking my husband to reach out to the funeral home, reach out to Now Lay Me Down to Sleep, which is a nonprofit organization that will take pictures and keepsakes for your baby or baby that is likely to die. And also a memorial gown. For the next 17 weeks, I walked through the halls of my federal agency dressed in high heels with a proud, beautiful belly, yet I was so broken inside. My colleagues saw smiles, but at night I cried myself to sleep, consumed by the grief and the fear. And on September 27th, 2017, at 37 weeks and 4 days, our daughter, Mia, was born via C-section because I had no amniotic fluid. To everyone's shock, though, she screamed when she was born. A loud cry that brought tears to the entire operating room that was literally filled from the door opening to the back of the room, because everyone was expecting a limp baby. She fought to live, and we thought just maybe we had a miracle. But the battle wasn't over. At 2 months old, Mia stopped breathing, not once but twice in the same day. We thought we were losing her again, and the last time I was actually picking Mia up and her lips started to turn blue. In desperation, we transferred her to Nemours Children's Hospital in Wilmington, Delaware. We spent another 2.5 months for a total of 118 days in 2 different NICUs, uprooting our life for the sake of our baby. And our little fighter was battling a congenital heart defect because of her rare disorder, which, as I mentioned earlier, was very rare, but what she was actually diagnosed with was Ellis-Van-Creveld syndrome, which is a rare form of dwarfism, less than 300 cases in the world, but it's highly concentrated in the Amish Dutch community. And as a result, about 70% of these babies have cardiopulmonary issues. and they still have a very high mortality rate. She graduated on January 24th, 2018 from Nemours Children's Hospital, NICU. And at 16 months, she underwent open heart surgery on April 16, 2019. But before that surgery happened, in the operating room, her heart stopped before she was put on bypass. She spent nearly a week recovering. But today I am proud to say I have a thriving 7-year-old miracle. And the last thing that I'll say is I talked about all those things. Just imagine, it was talked about earlier. I talked about having depression, deep depression. What is not talked about as a mom of the NICU and a cardiac ICU is when you go home, while you're in it, you're surviving. We're mothers. Mothers, that's what we do. And then you put mothers, and then you put Black, and then you put woman on top of that. You're in it. It wasn't until my daughter was unexpectedly rehospitalized that the monitors in the emergency room started beeping, and I fell into tears. And I knew then I was not okay. I was diagnosed with postpartum anxiety and PTSD, and just recently, major depressive disorder. I would have never expected that as someone who walks with life as a glass half full, super happy, and always joyful. But I endured microaggressions in the workplace that ultimately led to me leaving my national security career on top of COVID, having a cardiac child. Went into corporate. As transparent as I've been, after a while, the compassion and the empathy leaves when your child has medical appointments, unexpected sickness, all of the things, and as a leader. And the one thing that I would say as I wrap up here today is that it is not enough to have just the empathy and compassion. Action is what is important. And we talk about having access to healthcare. We talk about having access to Medicaid. All those things are great, but we also need protections in the workplace, especially for mothers who have babies that end up with complex medical needs, and for mothers who endure stillbirths, whatever that thing is, loss. They need the time, and it should be their decision. If they want to come back to work, fine. If they don't, also giving them the space to know that I had to literally decide how much I was going to work, mapping it out on a spreadsheet, yet still running back and forth to the NICU was just unbelievable in this modern day world here in the United States of America. And so I just urge us to really consider the impact of our decisions. We need to move beyond the political debates and provide mothers and families the care and the support they need, from prenatal to postpartum mental health services, beyond even just the 12 months. As a mom who exclusively pumped for 19 months, no one talked about what happens if you go beyond the 12-month postpartum period. And that 19 months was important to me because my daughter had to go through open heart surgery. So these are the conversations that really need to be happening. And I just want to say thank you all so much for the opportunity to speak today.
No. Okay.
Yes, ma'am.
Okay. All right. Thank you. First, let me say thank you to everyone who has shared their story over the past 2 days. This has really been a blessing and an honor to be a part of this. I want to leave you with a couple of thoughts, and I know that I am only going to do 2 minutes, so let me put myself on a timer here. The first one is I'll leave you with the word intentional. Intentional. At the U.S. Department of Health and Human Services, appointed by the President, it is particularly important that HHS Region 3, which includes the states of Delaware, Maryland, Pennsylvania, Virginia, West Virginia, and the District of Columbia, that as the regional director, I am intentional about the work that we do. What that means is convening a regional health equity council every first Friday, whether people like it or not, the leadership team in the region, and I say, come to the table and tell me about what you're doing to promote health equity. And they say, oh, well, we're giving out hundreds of millions of dollars in this, and we just got another grant for that, this, that, and the other. I said, well, that's business as usual. What are you being intentional about? Are you going out and talking to your stakeholders about innovative ways they could use the funds that they've received? We just saw that $400 million was given out for the McVee program, $10 million, over $10 million for the Virginia Department of Health. And how is that intentionally being used to help organizations that are doing the grassroots work? Organizations that are meeting people where they are. So that's what I'll leave you with on that area. The second area I'd like to leave you in with is about healthcare workforce development. I think it was Dr. Alexander who just talked about HBCUs. In Region 3, if you want water, you have to go to the well. You cannot expect people to come to you. And so while the federal government has lots of programs that talk about internships and pathways and this, that, and the other, if we don't go to HBCUs
That's right,
and Latino organizations and recruit from those colleges, universities, and let them know that these opportunities are there, and then provide support, because we just can't get them to medical school or nursing school and then say, hey, you're halfway there. We have to have support, again, being intentional about that support, so that they walk away after 4, 5, 6, some 7 years in terms of degree after degree, where they're able to find sustainable employment, which is a social determinant of health, and they're able to pay back loans and make a living. That's really, really key. And then the final thing I will leave you with in terms of this space is we talked a lot about mental health. We need to start normalizing conversations around mental health and not putting people in a box and saying, oh, that there's a stigma associated with it. If we talk about it, it's in the open. Let's continue to do that. And I especially want to encourage moms. Please call 1-833-TLC-MAMA, 1-833-TLC-MAMA, so that you can talk to someone and let people know how you're feeling, how you're doing, and that you can walk away, hopefully, from that conversation better able to take care of yourself and also your family. Again, I want to thank everyone for inviting HHS to be a part of this, and I appreciate, please, if you have any other questions, reach out to melissa.hurd@hhs.gov. Again, melissa.hurd@hhs.gov. Thank you.
Okay, so let's give Senator Anderson, Dr. Alexander, Ms. Hurd, and Ms. Shoemate another round of applause for those final thoughts. You all don't have to leave. I'm going to stay right there. I will not be here long. So
I was at a conference one time and the closing breakfast speaker stood up and said, you've been in workshops, you've been in lunches, you've been in dinners, you've heard all of this all of these wonderful things. And she said, Monday's coming.
Yes.
What are you gonna do? Then she sat down. That was her speech. Okay, so we've heard the stories, we've heard the data, we've heard the needs. We know what we need to do. All we have to do is let's get it done together. Monday's coming.
Now that is how you close us out. I just want to say thank you to everyone, for legislators and guests. If you are interested in visiting our beautiful state capitol, please meet us in the hallway. And I really appreciate all of the support, but this has not just been me. This has been a tremendous amount of staff, including Jasper Hendricks with the Black Legislative Leaders Network. And so I just want to say, in Virginia, it's very important to have things on the record. So I have to put it on the record that we could not have done this without Jasper. We could not have done this without the speaker staff. We could not have done this without the clerk staff. We could not have done this without the governor's staff, with DGS, Capitol Police, and everyone whose nerves I worked over the last 2 months. So thank you, thank you, thank you. You'll see next steps that we are not going to share here due to time, but we will be sharing 7 steps that we can take collectively across our states to move our Black maternal health agenda forward. So please look forward to an email with those next steps, as well as resources from our presenters today and contact information from our presenters today. Thank you all so much for making this a success. And for those who would like to see the beautiful Capitol, I will see you in 10 minutes out in the hallway. Flowers. And our intern, Micah, has said, please help yourself to the flowers on the center. Thank you all so much and have a great night. Great day.
Assemblywoman.